What is a SLAP tear? A SLAP tear occurs where the biceps tendon anchors to the labrum. SLAP lesion type 1 is a partial tear to the superior labrum, where the edges are rough and fray along the free margin, but the labrum is not completely detached. How can this be done? This can be done by traumatic events such as falling on an outstretched arm, bracing oneself in a motor vehicle accident, lifting heavy objects repeatedly or too suddenly, or doing overhead activities such as throwing a baseball. Signs and symptoms. The symptoms of a slap tear may include popping, clicking, or catching in the shoulder, pain when you move your arm over your head or throw a ball, a feeling of weakness or instability in the shoulder, or simply an aching pain. People often have a hard time describing or pointing to exactly where the pain is. Who is more at risk of a slap tear injury? Unfortunately, labral tears are hard to prevent, especially in athletes, because the force of the overhead motion contributes to the injury. Although athletes are most prone to labral tears, people who experience a traumatic event, such as falling down a flight of stairs, are also at risk, particularly older adults whose cartilage becomes more brittle with age. People who participate in repetitive overhead sports, such as throwing athletes or weightlifters, can experience labrum tears as a result of repeated shoulder motion. Treatment. Surgeons will usually conduct a physical exam, an MRI, or an X-ray, if necessary, to determine the severity of the injury and the treatment needs. Slap tears are usually treated with rest, or an anti-inflammatory medication, and in some cases, an in-office cortisone shot. This is followed by gradual stretching of the shoulder with a physical therapist for 6 weeks to 2 months. If physical therapy fails and the athlete still can't complete overhead motions, or the shoulder continues to dislocate, surgical treatment might be required to reattach the torn ligaments and labrum to the bone.